Okay, thank you.
All right, a warm welcome to you. I'm Rida Satki from the Geneva Learning Foundation. I'm here with Charlotte, who just got momentarily disconnected, but she's back.
And really so happy. Yeah, really so happy to be back, Rida. And
Okay.
hi, everyone. Yeah, warm welcome to you.
So this is a very exciting day because we have met. Now. This is our third weekly Monday call to prepare for no longer Teach to Reach, but to get to this day where we're actually going to be sharing the call for applications with you and taking you through the application. So we have some things to say before that, but the main message is going to be really showing you the application form and then discussing with you, listening and learning from you really how you're going to take this application forward. So first of all, I first want to commend and congratulate the Nigerian team for the launch of the Immunization Collaborative at Teach to Reach 10. As you know, on last Thursday, or as many of you know, because many of you were there, the Nigerian community was the most numerous, greatest in number, but also team of all the countries represented at Teach to Reach, and there are over 80 countries, and a very vocal and loud voice for immunization, but also, as you know, this Teach to Reach 10 was focused on climate change and its impact on health. During the Teach to Reach 10 session, on celebrating really 50 years of the expanded program on immunization. Again, we heard the voices of Nigeria loud and clear. And when it came to the Movement for Immunization Agenda 2030 as part of that session, as part of that EPI at 50 session, the same. So I just want to congratulate and commend you and tell you how much we appreciate at the Geneva Learning Foundation this commitment that you have to the children and families of Nigeria, and we're really proud and respectful of the fact that you have trusted the Geneva Learning Foundation, and in this case, of course, along with partners, UNICEF, and of course, the National Primary Healthcare and Development Agency for this initiative. I do want to remind you, so last Thursday was the official launch and announcement at Teach to Reach 10. Today, we are pleased to announce that the call for applications is now open. Charlotte and I are actually going to show you that call for applications in a minute. And you can see that the next date coming up, we will have a call on the 1st of July. But the main thing to pay attention to is the call for applications is opening today. It will close on the 5th of July. So that is a very short deadline. We will not be extending it. We'll be sending the letters of acceptance out for this exercise right afterwards. And it is going to be a select group. It's true that in some cases, pretty much everyone who applied was selected. In this case, we will be really working with the best for this initiative. We may then expand and open up later, but this is for people who really have that commitment to public health, above and beyond, perhaps in some cases, their job descriptions. A reminder of the key dates, and we've shown this, of course, in previous meetings as well, but we'll be starting the exercise on the 15th of July, and we'll be going through the 22nd of July for the live sessions, followed by what were the deadlines you don't see here, the deadlines for the project, which will be to perform a root cause analysis of an immunization challenge that you face. So really today, there are 4 next steps. For those who have not yet done it, is of course to register your interest. Second is to share the call to action. I'll be sharing, I think, I'm not sure where it went actually, but we do have a WhatsApp link to share there. Let me just see if I can get that. I think that's API, because that is quite important to share. In fact, yeah, here it is. So just And we have not shared this link before, so today is the first day where we are, because applications are now open, we've been basically, many of you, in fact, the application, what's amazing is that the landing page has been shared by many people. But today is the day when we can actually begin to share via WhatsApp, which is probably the main way to do it. Now, do not miss step 3, which is to complete your application. And this is a critical step because if you have participated in these meetings, if you are a leader in the movement for Immunization Agenda 2030, if you are an alumnus or alumna of IA 2030 movement, you will automatically be accepted into this initiative. But you still need to complete your application, and your application still needs to be of sufficient quality in order to qualify. And then, of course, we do ask that you attend Monday for the next actions. And we'll be looking at who has attended every meeting, and that will be the core group that we will look to, because if you are able to really and committed enough to show up 4 times in a row, we know that you are dedicated and committed. We respect that, and we'll be honoring that by making sure that you are the first to gain the benefits of this exercise, the benefits of the partners we're bringing together for this exercise, and so on. And now, what we have still been sort of fine-tuning is the partnerships. So I believe there were 12 organizations that registered to become partners for the collaborative. So you need to be authorized by your organization to become a partner of the collaborative. And in that case, you complete the partnership form. What Charlotte has been working on is the letter of endorsement. And that is, so the partnership means that we recognize you as a partner and you commit to supporting this collaborative, and we commit to supporting your organization. So this is for organizations, not individuals, but of course, we expect the leaders to be the ones to go back to your organizations and to say, our organization should be a part of this, and then to be authorized to do so in order to complete the partnership form. The second part is actually not for us, but for people in your organization. So if you work in a state or LGA, local government authority, and you work for the health service, we are going to invite you, and it is up to you to determine if you're allowed to do this, and if so, what is the best way to get this done. But we'll be sharing a template letter of endorsement, which can be signed by an organization, obviously by the person who is authorized to do so, to encourage and support staff participation in the collaborative. So this is in other countries. We have had the national EPI director as well as the regional directors basically tell their staff, they encourage them to join, support them to join, including work time in order to be able to participate, to complete the activities. Whether or not this is possible where you work in your organization, that is for you to determine. But we're going to be offering the template that an organization can use to really signal to their staff that this is something that is worth doing. It is in collaboration with the NPHCDA and UNICEF, and it is being led by scholars, immunization staff throughout Nigeria. So that is with respect to organizations, how organizations can be involved, not just individuals. The really important step is the closing deadline, and that is Friday, 5th of July. That is not this coming Friday, but the following one. So you can see that there's a very short window for the application process. And also, that means a very short window for people to be informed, to share the information, and to get the information to your colleagues, and also convey to them that after the 5th of July, they will not be able to join this first collaborative. There may be others in the future, but right now, there's nothing confirmed. So the best thing they can do is actually go through the application process now. And just as a reminder, I do want to run through again what the initiative is about. So, the idea is to connect to each other as health workers. And This is for all you need to participate is you need an internet connection and you need to be willing to learn, share, and work with others. If you face any of these challenges, the ones that are shown on screen, children who have not been vaccinated or children who have missed vaccines or outbreaks of VPDs, of vaccine preventable diseases, community people who do not trust vaccines, communities that are hard to reach, barriers of any kind that make it hard for some people okay, Charlotte is saying that she cannot hear me, so I'm hoping if others could confirm that she is having connectivity issues, please let me know. It looks like my connectivity is fine, but we're never sure. Is there anyone who can confirm that you can actually hear me? Okay, thank you, Chitima. That's reassuring. And sorry, Charlotte, that you're having these connectivity problems. Now, okay, thank you, Zubair Umar and Olainka Bamidele. So if you work with people in remote or rural areas or hard to reach areas with poor people, marginalized people in cities, people affected by conflict, people who move around a lot, refugees or displaced people, we also especially encourage you to join. And this is why you matter. As a health worker, you are there every day to see and understand the health challenges in the community you serve. That is really why we proposed to UNICEF and then to NPHCDA to organize such a collaborative. Again, it does not matter who you are in the system, what your job is, or where you work. And again, the Geneva Learning Foundation is organizing, facilitating this exercise, but this is really our goal is to support Nigeria's movement for Immunization Agenda 2030. Now, one of the key messages is to say, we know that you are short on time. And this program, every step of it is designed for people who are busy, all right? And it's about giving and receiving support when you need it. There are no superfluous and time-consuming tasks. Everything is focused on actually helping you. That is what you should keep in mind. And again, in telling your colleagues about this initiative, this is key to emphasize that this is to help you. It is not for learning as an end unto itself. There are very good universities in Nigeria to achieve those goals, and those are important goals. But this is about connecting to each other in order to solve problems that you are facing, and to say we're stronger in numbers and united we stand to face these challenges together and to learn from each other as we go. So again, there's one link, and that is the only official link. If anybody shares another link that is not the correct one, it is www.learning.foundation/Nigeria. So again, what will we do exactly in the exercise? When you apply, you'll identify a local challenge that matters to you and identify some actions that you want to take with respect to this challenge. You'll identify during the exercise, we'll focus on root cause analysis, and that will help you determine whether the actions you initially identified are the right ones. Once the exercise is over, your destiny is in your hands. What you do with what you learned, the root cause you identified, the actions you revised, that will be in your hands and in the hands of your colleagues that you've gotten to know and learned to work with. We'll have a focus. We'll include a focus on interpersonal communication skills. For some of you who attended Teach to Reach, you know this. And the big difference today, we've already shared this information with you. It's been available. We've asked for your feedback. We've updated in response to that feedback. But the key is today the application is now available, and we're going to show you that with Charlotte in a minute. But we did want to remind you, because as ambassadors, as alumni, as leaders of the movement for Immunization Agenda 2030 in Nigeria, what we're asking you to do for this initiative to be successful, there is already a core group of people who are already committed, and you have already done amazing things for the children and families of Nigeria. What we're asking you to do now is to share with your colleagues to see how much you as leaders are able to broaden the circle. And you're seeing the slides on screen on certification. Of course, you will have questions, people asking you questions, basically wanting to know what's in it for them. So certainly for some people, earning a certificate, having what they're able to analyze for the root cause of their challenge is significant. Now, more information, you know that there is a single page where you will find all of the information, what we call the landing page. And I'm sharing this again, but of course, many of you have already seen it. So we have the questions for you is really, what other questions do you have at this stage? We want to know who you are going to invite, what you're going to say to them. And then for you, unless you have decided not to participate in the collaborative, what is the challenge that you will work on in the collaborative? And how do you think the collaborative is actually going to help you? So those are some of the questions we want to ask you. We're going to ask, but if for the sake of time, please do raise your hand or write your answers to these questions or any other issues or concerns that you'd like to share. But I suggest I'm going to give Charlotte, how is your connectivity? Are you able to share the, yeah, we would love to have you go through the form.
Okay.
Let me give you the link with your name on it.
Okay.
All right. So this is, Charlotte is going to show you to apply. Are you going to apply for this?
Hi.
All right, so here, I'm just going to share this in Zoom, and then if you'd like to go, and if we see it doesn't work, then I'm happy to share my screen if you're still struggling with connectivity.
No, I hope it should work. So I'll be able to, should be able to share my screen. Okay. All right. I hope you can see my screen, Reda.
Yes.
Okay, so great. So so let me just start by saying, Reda, that we have actually skipped a stage here because normally people have to go to the landing page and click on request your that is apply here, and you'll receive an email with a personalized link. So when you will click, it will be your name, welcome, like it's my name that is here. And if you are not, if I were not Charlotte Mbu, I should be able to click here to request my own personalized link. So I'll click on start. And here we are required to type in your email. My email is already here, so I'll just retype. And so when it's your turn, you should type your own email. You just make sure that there are no mistakes. And then I click on OK. And so while we ask you questions and what we do with your answers, so you may want to really go through all of these. There is our privacy policy that is there. And you can ask us any questions using the email. But the most important thing is for you to accept. You have to click on accept. Scroll right down, you click on accept. If you say you don't accept, you can't move forward. So and now there's a question, does your direct supervisor at work agree with your participation? So we want to support you to advance your country's directives and policies and build upon guidance from the World Health Organization. But you are responsible for compliance with your professional obligations and regulations, including the duty of confidentiality for government and other employees. So I will say my direct supervisor agrees with my participation. So it's going to be yes. If you haven't asked yet, you can indicate the third option, which says I have not yet asked. And then we have the Scholars Pledge for Impact. It's very important to sign this pledge. And for members of the movement, we are very familiar with this pledge. So I accept. And then there is the commitment to confidentiality. I accept. And then now personal information. The first is your gender. So click on the gender. And then your date of birth. It's important to type the day, the month, and the year, the number. So let me just go ahead and type mine. Okay. And then your WhatsApp number. So since this is the Nigeria Immunization Collaborative, it is by default the flag of Nigeria that is there, meaning your country. And so you just need to type in your number, your WhatsApp number. I am from Cameroon, so I don't have a Nigerian number. So I'll look for Cameroon here. And then I'll type in my WhatsApp number. And then you click on OK. So I agree to have my WhatsApp number and email shared with other members of the IA2030 movement when required for activities. Yes, this is a peer learning exercise, and I definitely want to be able to connect and learn with colleagues from other states, from other LGAs, from other countries. So my response is going to be yes. And so now the next set of questions, would like to know about your affiliation and focus. First of all, at what level of the health system do you work? So I'll say I work at a local government area. So you could be working at the local LGA level, at a health facility, at the states, at the federal level, multi-country or international. So for me now, I'll say I work at a local government area level. And in which country do I work in? For the purpose of this exercise, I'm going to indicate that I work in Nigeria. So I'm going to choose Nigeria. And the state that I primarily work in. So I'll go for Abia State because it's top on the list. And then one local government area. So I'll go for Aba North because it's top on the list. And then what organization are you affiliated with? I'll say I'm working for a non-governmental organization that's in Abia North in Abia State. And what describes your current role in the NGO? So I'll just indicate that I am a volunteer. And how many, in some cases, if you are government, it will ask you if you're a community health worker, if you are, you know, a medical, a nurse, whatever. So you just have to pick out your role, or if you occupy more than one, then you go ahead and indicate how many years of experience. I'll say, okay, I have less than 3 years of experience. Okay, job categories apply to you. So I'll take the first. I am a community health worker. Okay, so you say here you can choose more than one. So I am a community health worker, and at the same time, I could say I'm a public health specialist. And so I say, okay. So to start your IA2030 action plan, describe one priority challenge you face in your immunization work. And it's very important for you to read the description. So we suggest you focus on your most difficult and important challenge. Focus only on one problem where you can take action. Be specific about your situation, not generalities. Help others understand why it matters. Explain your situation. What is the root cause of your challenge? What will be different if you overcome this challenge? So in order to save time, I'm not going to go into all of those details, but I just really wanted you to pay attention to this. So I can say my challenge is low HPV vaccine uptake due to high vaccine hesitancy in my community. Remember, I'm a community health worker. So that's just an example. I would say because of it, they say, go to explain the situation. You say, since we started the vaccination, people have not turned out for sessions because of rumors on the internet or whatnot. But that is just maybe what I wrote. And then remember, now in one sentence, summarize your challenge, what you want to do about it. So what is your challenge? So my challenge is low HPV vaccine uptake due to high hesitancy. I want to, let me look at want to increase vaccine uptake through sensitization in my community. That's just an example, eh? It's just an example I'm giving. You may want to be more explicit when you are typing and you have a maximum of 256 characters, and there is a possibility to download examples of challenges. So I click on OK. And the question now is your challenge too broad, general, or vague? And I'm going to ask you in the comments, if you can type in the comment, is my challenge, the challenge that I put, is it too broad or is too vague? Just let me know. And if you tell me that is too broad or is too vague, it's not specific, then I may need to improve my challenge. And then if I click on I need to improve my challenge, I will come back to it and I have to retype it. And if it's okay, I type it until it is okay. And then I can indicate here that it is specific and I can take action. So I go ahead and click, it is specific and I can take action. Okay, so now you all know we have the IA2030 strategic priorities, and the Immunization Agenda 2030 has 7 different strategic priorities. So you review the list of the SPs and you indicate, you select the SP that aligns with your challenge. So for me, it's going to be SP2, which is commitment and demand. So I'm going to take HP2, SP2. In some cases, it could be coverage and equity, but for me, I'll take it as commitment and demand. And then for each SP, there are what we call key focus areas, and the IA2030 has 47 key focus areas that are classified under all the different strategic priorities. So you need to review the list carefully. And my strategic priority was SP2. So I come here, I can decide if I want to see only SP2 key focus areas. I can type SP2 there, and here I have only the key focus areas for SP2 that are showing, and there could be barriers for immunization. So I need to look for a key focus area that applies. I could take barriers to immunization, and then is your challenge related to any of this? I know the HPV vaccine is being introduced in Nigeria, at least in some states. So in my state, I know that it was introduced, and so it has to do with introduction of new vaccines. And so I click on that. And then is there any other thing? Let me see, adults and children missing, reaching 0 dose, no. Disruptions, no. So it's really introduction of new vaccines. Here, there is a possibility for you to select more than one. So I took introduction of new vaccine and I click on OK because that's what aligns with my challenge. The question now, to tackle your challenge, define the goal of your IA2030 action plan. So what will I need to do in order to tackle my challenge? So, and this goal describes what you want to achieve with respect to your challenge. And here you have a reminder. My reminder is my challenge is low HPV vaccine uptake due to high hesitancy. And I want to increase vaccine uptake through sensitization in my community. So my goal could be organize sensitization sessions in the 7 words of my LGA. That's still just an example, but that's what I want to do in order to address, that is sensitization in favor of HPV vaccination. So that's just an example, but I want to put that, and then I click OK. So why is this goal important? I'm not going to type all of that, else I'll take so much time. And what does success look like? So success for me will not just be organizing the sensitization sessions, but increasing my HPV vaccination uptake. So I could probably say HPV vaccine uptake in my LGA from, if we are, let's say 17% from, I can say 17% to 25% by let's say December 2024. And again, I say it's just an example. You have to think through exactly what you want to attain. And have you started taking action towards this goal? My response is no. So tell us about your stakeholders. So who are those, who will you need to work with to achieve your goal? What type of support will you need from the communities you serve? How should your organization, supervisor, and partner support you? What are your likely barriers to securing their support and commitment? What are you going to do if a stakeholder does not provide the support you need? Could the support of the IA2030 movement colleagues be helpful to you? And if so, how? So here you really need to take time to type out exactly your stakeholders. So will be community leaders. And by community leaders, I have maybe, and I'm just religious leaders, women association leaders. So those are the stakeholders. What kind of support you in mobilization of the populations, in sharing of the flyers, responding to questions, whatever, supervisor. So you type all of that, and then do you need additional funding to achieve your goal? So usually we encourage you to carry out activities that will not require any additional funding, any additional funding or whatever. So what is really important is for you to think through. So if I'm going to be doing sensitization, usually is sensitization already part of my work? If it's yes, it means I already have resources to go to the field. So I can just add in HPV vaccination sensitization. So my answer will be probably no, I don't need any additional resources because that's an activity that is already budgeted and I am used to doing. So how much time will you need? I said, I want results by December. So I'll say 4 to 6 months. Okay. And then tell us more about the resources and timeline. It's just to say, okay, I will need maybe support from colleagues and supervisors, but no additional resources, and should be able to meet my goal by December 2024. For example, that's just an example still. And I see Red also put in the chat that is women will be protected from, women and girls from cervical cancer. Okay, that's what success looks like. Now, we would like you to identify 3 different specific actions to achieve the goal of your IA2030 action plan. We'll ask you questions about each action. Let us start with the first action. So if I want to carry out sensitization, what do I have to do? So maybe I want to do a community mapping. But you need to actually carry out community, you state it out clearly, community mapping. Have you done this before? Yes, probably I did it when it was COVID-19 vaccination. I did it for other vaccination, for 0 dose, for example. Yes, so I've done it before. Now I want to do it with HPV. And who will do it? Maybe I'll do it with others, with my colleagues, not alone. And so how much time do you need to finish these actions? So it should be less than 4 weeks. So 4 weeks or less. And how innovative is this action? How is this something? So maybe it's not very innovative, it's something that has been done before. So tell us more about this action. So you take the time to explain what it would take. So identify, maybe identify the quotas. I don't know. Yeah, just you have to identify the places, where the schools, the primary schools. You have to identify maybe out of school children in your community. Where are they based? What are they doing? Are there associations that are in charge of that? Is women's association or mothers, caregivers, all of that. So it's that. And then we would like you to identify the second of 3 different specific actions. So now I'll have to, plan the different sessions by word. So in each ward, where do I want to go to have these sessions? Is there a town hall? Is it in the quarterheads palace, in the chief's palace? So where do I want to? So maybe that's what I want to, and the date, when and where exactly will I do? What will I need to do that? So again, have you done it before? Yes, or maybe no. Who will do it? I will do it with others. And then how much time do you need? It should still, for me anyway, it's 4 weeks or less. Is it innovative? Maybe not. Really, so tell us more. And then you take again the time to type in more. That's how will this action help you to achieve your goal? What needs to happen and when? What are the steps? So this is where you really put in all of the details. Who will carry out this action? How will you know when you have finished your action? How will you know if your action is successful? So, and then now the third action is really the hold the sessions proper. And then, okay, maybe have you done this before? Yes, still the same. You do it with others. So you need to, like as we said earlier, identify key stakeholders. And then depends on you if it's something innovative or not. And then you come again, you repeat the same process. You have to do this 3 times. And then what else needs to happen to achieve your goal? So what other actions need to be taken? Maybe follow up of vaccination sessions. That's one thing you need to, because it's good to sensitize, but afterwards, will the vaccination sessions take place? When they take place, is there any mobilization within? When will that happen? So that's just an example that I'm still giving. And then do you wish to share? So that is it for the action plan session. Do you wish to share experience to help you with your IA2030 action plan and to help others? So yes. No, I am not interested. Yes, but I may not have time to do this. And yes, I will prioritize this. So this is a peer learning exercise, and it's really learning from the experiences of others. So I definitely want to share my experience and also learn from the experience of others, especially those who have already introduced the HPV vaccine and are doing better than me. What did they do to make a difference? I want to learn that. So I will prioritize it. And we encourage you to share your challenge, goal, and actions in the experience sharing sessions. And you can also get help from others and also help others as well with their own challenges. Now, to understand your challenge and action plan, we have a few questions about the general situation where you work. So it is really about some of the indicators, the immunization indicators where you work. So the name of your organizational unit. So maybe I was at the Aba North LGA, for example. So I put that. And then what type of setting is it? Let me just put it for the sake of the exercise as a rural. And do you know the size of your vaccination target population? So if you know it, you type yes. If you don't know it, type no. And there is nothing wrong with you not knowing. So there's nothing wrong with you not knowing. But if you know it, you type yes. And the closest estimate. So if I say, okay, 33,000, that's the population where I work. And then they ask the number of outreach immunization sessions that were planned and then actually carried out last year. Do you know? If you don't know, you simply type no. And in this circumstance, I don't know because I'm just a community health worker. So I don't know. So I type, I don't know. But if you know, you type yes, and then you'll be asked to type it. So do you know the ANC coverage, the antenatal care coverage in the local government area? Again, if you know, you type yes, and you type the number. So you just need to type a number. So if it's 55, you type 55. Don't add the percent sign, just type 55. And automatically it is recorded. We know that it's 55%. So you type 55 and you type, okay, so this is a percentage of women aged 15 to 49 with a live birth in a given time period that received antenatal care 4 or more times. So for the sake of the exercise, I put 55%. Now, do you know the current Penta-1 coverage in your LG, in your locality? So that is the coverage for below 1 year old. That is 0 to 11 months. So if you know, type yes. If you don't know, type no, simply no. And then the penta-3 coverage is the same thing. And then the MCV1 coverage, if you know, you type yes, and then you can say, okay, MCV1, we have 56. For example, you type, okay, MCV2. If you have introduced MCV2, you type yes, and then the coverage could be something like 42. So, and just type a full number. And then, has the HPV vaccine been introduced in your area? Is that yes, no, or you do not know? And it's okay if you do not know. So we'll type yes for my abandoned, because that's where my challenge is. And do you know the coverage? Because it's my challenge, yes, I know the coverage. And I say, okay, the coverage is just 17%. That's why I want to take it to 20 something. So well done. You have now prepared your IA2030 action plan. The question will ask you is, are you ready to take action? If your action plan is accepted, you'll be invited to join the Nigeria Immunization Agenda Collaborative to work with others to analyze the root causes of your challenge. So I am ready to take action. So I type yes. So what will you seek to achieve in the collaborative in a single sentence with an action verb? Describe what you will focus on in the collaborative. So for example, I want to learn from the experiences of colleagues' strategies to increase my HPV vaccination coverage. For example, that's my own example, just giving, yeah. So your example could be based on, you know, but so now what is the most important action that you will carry out in the first 7 days of the collaborative? So in a single sentence, the action verb, describe an action that you will complete in the first week. So maybe I want to really understand the root cause of my challenge. That's an example that I'm just giving you. Okay, you type on okay, and now we'll ask you to complete your, that is to complete your IA2030 action plan, write your full legal name. And please remember, this is the name that will appear, that appears on your birth certificate and your passport, because the name that will appear on your certificate. So here, I'm not just typing my first name and my last name, I am typing my full legal name. So you type your full legal name and you click on okay. So here you have to, before you submit, you certify I, Charlotte Dwambu, confirm that the information I have provided is true, accurate to the best of my knowledge, information, and belief. So do not forget to click on the submit button to send your application. And because it's a Nigeria collaborative and we know Nigerian colors are white and green, so we put a green submit button. So you click on submit. Okay, so we are thanking you. Receive a Thanksgiving message and for your application. We have received your application, and please save your full, note that your full legal name has been recorded as, and the email that will be used to communicate with you is, so that is it. And then please invite a colleague. So you click on this link. So we are going to attach the WhatsApp link there so that you can invite your colleagues on WhatsApp and other media so that they can also apply for the exercise. Okay, Reda, I don't know if there are any other additional tips and ideas for successful completion of this application. If there are any questions or comments, we are also ready for those. Thanks, Reda. Over.
Thank you very much, Charlotte. I thought that was a brilliant demonstration. And you did it in like 15, 20 minutes, or yeah, maybe a little bit more, but you did it very quickly and very well. So you have many of the Nigerian scholars and IA2030 leaders in the room, of course, recognize this application if they participated in the action plan hackathon that we ran in May of 2022. So I remember one person asked the question, well, why are we doing this again? Well, unless you have solved your challenges or unless you have no new challenges. If that's the case, then you probably do not need to join this exercise. But if you are still facing challenges in immunization, then this is a useful exercise, we believe, and it will be, of course, your decision whether you agree or not. Now, as you can see, the application is quite detailed. So you may say some of your colleagues, it's going to be too much for them. What can help them is if you can take the time to show them, because we know you have done this. You are the leaders. You can show them the way. You can lead by example. So that is what we are inviting you to do. And of course, it is up to each of you to decide if you have time for this. What level of involvement? Do you want to do it yourself? Are you going to go a step further and help others? But as you know, with peer learning, that is really the spirit of what is needed. Okay, I saw Abubakar Saleh had let me see, where did you see that, Charlotte? Yeah, let me just, so if you'd like, if you have a question, if you have a comment, what I can tell you is as Charlotte was finishing up, I pressed on the button. So all of you who have registered on the Nigeria landing page have now received the link to your personalized application. So please do go ahead. We are going to update yes, Charlotte actually found a few, let's say, a few things that need to be improved. So we're going to work on those as quickly as we can, such as the WhatsApp link, for example, so that you can get that and get the full benefit of that. Let me just actually make those updates, but we'll open up for questions. Abubakar Saleh, your microphone is ready to be unmuted as soon as you wish to do so.
Yeah, and Reda, I just wanted to add that I took more time because I was posing to explain. If I was just filling, I would have probably finished much quicker. And that is, I actually tested the form and took the time to really answer to some of the questions prior to this. So yeah, and it.
Yeah, and I think Ndayo says that was brilliant and good. And Ndayo, I know you've been through many TGLF applications and questionnaires and have been successful each time. So think about, let me go back to the questions that we had for you. And again, let me just share again. Yeah, here. So the question is, who are you going to invite and what are you going to say to them? So remember, you've seen Charlotte go through the application. I walked through some of the basic information about the exercise. We say course rather than exercise, and I'm going to show you what the actual invitation wants. When you make the request, before you got a kind of placeholder message. Now you will get this, and actually this is here. So this is what you'll get. And it's very simple. There's not a lot of text. We may add some more explanation because sometimes people do want that. But you get to the point. You have the link to start your application and the link to invite your colleagues. So if you see anything that is wrong from what Charlotte and I have shared, or that you think could be improved, this is the time when we can still make those changes. We have only until the 5th of July, to really share this call for applications. And what we'd like to invite you to think about is, who are you going to invite? What are you going to say to them? Because if it's just WhatsApp, there's so much that is shared on WhatsApp all the time. People stop paying attention, but that personal touch can still make the difference. And then of course, you're going to answer this in the application, but if you'd like to share, what is the challenge that you want to work on? And also, how do you think that this is going to help you? You've been through this. Many of you have been through this process before. And again, we think, because you have done this before, you are in a unique position to lead this initiative, and will be on the basis of attendance and other considerations. We'll be inviting those of you who've really displayed your commitment over and over again to join the leadership circle for this collaborative, and to recognize your leadership. So I'm going to mark a pause here. Perhaps if there are no questions or comments or concerns, we can close now, Charlotte. But let's pause, and if you wish to speak, some of you already are unmuted. Let me just or otherwise raise your hand so we can actually hear from as many of you as possible. This we knew we would be our first priority was to show you the application, how it works. I'm sure many of you have recognized it, but nevertheless, we would love to hear from you before we close.
Okay, I'm muted. Dr. Edward Ndayo, the Geneva Learning Foundation, Nigeria Federal Capital Territory. Thank you so much, Reda and Charlotte. Thank you for that brilliant presentation. Yes, and Charlotte, thank you further for sharing that invite on the WhatsApp. I've already responded, but I've already shared that one already to the various groups that I'm a member. Yes, this is related to Nigeria. And I usually say this, that our people like things that are linked directly to them. So my message will be to remind this cohort that I've been working with that this is not our own. So they will have the opportunity to showcase or to also learn from each other across the length and breadth of the country. So the opportunity has come that they should join in. And because I'm going to be part of that, I've already registered. So as the General Secretary of the Coalition of CSOs in Nigeria, at this time, I have 2 years to operate as such. The coalition platform has so many NGOs that are focused on immunization. So I'm going to post this and remind them that this is, in fact, I've already shared what Charlotte sent to me some few minutes back to them, and they have started making comments. So after this, I'm going to reinforce that there's a banner usually used, important announcement. Attention, please. It's a red banner that can attract attention. At times with a gong. There's a gong flyer I have, so I snap it and I use it as a banner effect, so that when I post that and pin it to the group, many people will be attracted to it. And with that message that this is coming to Nigeria, and we have got to brace up and share our ideas with each other and learn from each other to improve on, because we have already agreed that the zero dose numbers being thrown up in Nigeria is unacceptable. And we should work together to ensure that we are innovative and we are focused and we use the necessary global thinking to act locally. So that is from my own side, and I believe that this is possible for me to do. Thank you, and over from me.
Thank you very much indeed, Ndayo. I saw Tina was also unmuted. Others, we'd love to hear from ambassadors and others. Who are you going to invite? And we have very little time to spread the word for this initiative. 5th of July is the closing deadline. There won't be any extension. And what are you going to say to those that you wish to invite? Yes, Caroline, go ahead, please.
Yes, well done, Charlotte. That was very practical, and then you made it so simple to feel, and even tell us the type of collaboration and outcomes that we can look for. In my own case, I will have to invite the people I've worked with before in UNICEF, especially social mobilization consultants. I'll invite them because they are on the field. Like I said, I wasn't part of the HPV campaign that happened both in Enugu and Lagos, where I usually work. I mean, that I am now when I'm in Nigeria. So I'm going to invite them, and I will see how I can also work with some CSOs. I'll collaborate with Dr. Ewart, because I heard, I just said that he's the secretary of CSOs. I would like to ask him to incorporate the CSO that I work with and the NGO, that is the lead, so that I can see how they can participate. So over. Thank you.
Thank you very much indeed, Caroline. What I'd like to add is for those civil society organizations that you're affiliated with, not only can they have their membership, volunteers and staff apply, but they can also become partners as organizations for this for the collaborative. So that is a major change for IA 2030. Recognizing not only individuals, but also organizations. And of course, for those of you who were at Teach to Reach last Thursday, you saw the presence and heard the voices of organizational leaders. That is what we will be again recognizing and honoring organizations for their roles. Thank you.
And Reda, I just wanted to add to Caroline that the challenge is not just HPV. There are many other challenges. It could be zero dose. It could be, outbreaks, whatever. So it cuts across a span. The example I took today was just HPV, but it could be any other immunization challenge.
Right. And that is where this is, because you know what your challenges are. We are not going to tell you what they are or which ones are important. You know, because you are there every day and you support the community, you work with the community. So if your challenge is something else, if it's zero dose children, if it's diphtheria outbreaks, if it is measles, whatever is of concern to you, that where you want to be supported by your colleagues and you want to learn from them and you want to help them if they're facing a similar challenge, that's what this collaborative is all about.
Okay, thanks, Reda. Now we have so many mics that are open. So can we start?
Everyone.
Yeah, hi, Fatima.
How are you today? Thank you so much for the remarkable presentation. It really made filling the form quite easy for us.
Okay, so now the next step is for you to check your email and fill in the application form.
Yes, I've received the email. Definitely, I'll be sharing it with in fact, my colleagues are very much interested. The College of Education I work with is actually responsible, or one of the institutions that train community health workers. So my students, and they're all interested because this is something that they're basically basically go into the field once they graduate. In fact, before they graduate, they start going into the field to have practical experiences of everything that we teach them. So most of them are trained to give out immunizations. Most of them, that's what they do. So this is something that my HOD, everyone is interested in enrolling the students, and hopefully they go ahead and follow the process to enroll and engage themselves in it. Yes.
Thank you. So one idea I could give you, Fatima, that I used in the past with colleagues was filling the form with them. That is, as I say, while you are encouraging them to also connect, whether it's on their phones or on their computers, and fill at the same time. That way
but at the
follow.
moment, I will have to just I have no choice but to just follow up online, because I'm not even in the country. I'm in Saudi Arabia at the moment. Yes,
Okay.
so I just have to follow up with them online, but they are interested. They are very interested.
Okay, that's
Thank
Adamu Dangona.
Yeah.
Hello.
Yeah. Yeah. Good
Yeah,
evening.
Good evening to
Good
you.
evening, all. Yeah, I salute your efforts, Mrs. Charlotte and Reda and all those teams. So in fact, this is a kind of a very good another initiative. I remember the last time we did a kind of an action. We last year, I think last year, we developed an action plan. So we are able to undergo so many kind of program, the feedback mechanism and others. That kind of an action have in fact given a lot of experience, and a lot of people have joined the TGL kind of a movement. I know I've influenced a lot of people before they are now in the forum. So therefore, this is a kind of a very good initiative. Then we have many friends, many staff that colleagues. We are together with them. So we will definitely influence them in order to join the movement, in order to achieve all remarkable vaccination effectively, in order to reach all the areas that can have not been reached before, in order to ensure that the vaccination and the awareness has been reached into the hard to reach area and those that can have not been able to accept the vaccination. So therefore, in fact, it's a kind of a very welcome idea. Job well done. Keep on doing it. So we are looking forward to develop another action plan in order to achieve it within the time frame that has been given. So thank you very much. This is what I can be able to say.
Okay, thank you,
Nice,
Adam.
thank you very much.
I don't even know.
Hello.
Hello, Charlotte.
Hello.
Yeah. Hi, Tina. Good afternoon. So can we start with
Good
Tina?
afternoon. I want to say thank you for taking us through the action plan forms, feelings, and I was very happy to see that some of the issues and the way you walk through it was really making the whole work simple, as if we have just started implementation. So for our colleagues that are here, I just want us to try as much as possible to be focused on the challenges that we are really faced with, so that the action plan will be useful when we're implementing it. Problem focused action plan will really make the work easier, identifying cause of the problem, and then what is the way forward, the actions to be taken will also make our implementation easier. So for me, I have a lot of colleagues that are already part of this TGLF program. We are interacting, and for those that are not here, we are going to make sure we put them along to see what we are doing based on the progress we are making as being part of this program. Thank you, Charlotte. Thank you, Rita. Over.
Okay.
Hello.
Yeah, Charlotte.
Okay.
Hello, on this side.
Yeah. Good afternoon, Zubai. Uma, please, can you tell us who you are, where we work? And we're actually already out of time, but I think we can listen to you.
Okay, I'm Zubair Umar Lamba. I'm currently working with the University of Maiduguri Teaching Hospital in Borno State. I actually did a nice presentation. I've been following it up. It's very nice. The form, the way you made us to fill the form, it's quite okay. For me, I did my research on particularly HPV during my fellowship program with West African College of Pharmacy. I personally found that the knowledge attitude of some of the health workers regarding HPV vaccine were a bit high, but the practice was low. So from my own side, I will try and engage all those people that assisted me, the health workers that participated in my research, and the primary health care centers that helped through the research as well, to see that they participated in this collaborative effort. Thank you very much. Because you said we're out of time, it's over from my side. Thank you.
Thank you so much, Zubai, for that. And just keeping in mind that the application is open today, only up till the 5th of July. So the time is really short. So it's great to encourage colleagues to join. Reda, I don't know, any final words, parting thoughts before we separate for the day, knowing that we'll be reconvening next Monday?
Yeah, I no, just to say, Charlotte, I can feel the excitement. I think it's we're really proud of this Nigerian community. It's just amazing. We're proud to be supporting you in launching this collaborative, and we can't wait to see how many people you will in fact be able to mobilize around the needs of children and families in Nigeria, and to follow through all the way to the end of the exercise. We will be having a commencement event. And I hope that each and every one of you will be at the commencement event, just as you are here now before the launch. Thank you.
Thank you, Reda. Thank you, everyone. Wish you an excellent week, and feel free to reach out to us if you have any challenges. But our eyes will be on on our pages, receiving the applications that you are sending in, and maybe probably seeing how to keep you up to date with that as well. So I'm sure when we meet next Wednesday, we'll be able to share maybe some numbers with you on the number of applications received. And we do hope that by that time you would have reached as many colleagues as possible in your areas of work. Thanks again, and bye for now.